Chapter 1 Review Questions. Role and responsibilities of the support worker. Question number 1, multiple choice. Choose the best answer. A reflective practice review is A. Thinking about problems that occurred with a coworker. B. Being discreet when speaking with a client's family. C. An honest self-evaluation of all the care you've provided to the client. D. Planning client care around staff availability. The correct answer is C. A reflective practice review is a self-evaluation of care provided with the goal of identifying ways to improve clinical performance and caregiving. Question number 2, true or false? In long-term care facilities, support workers assist clients with complex health challenges. The correct answer is true. In long-term care facilities, support workers assist clients with complex health challenges. Support workers also provide comfort and end-of-life care to dying clients so that they can die with dignity. Question number 3, multiple choice, choose the best answer. A support worker's scope of practice refers to the A. Skills that the employer wants to perform. B. Amount of practice that is needed to perform a skill safely. C. The legal extent of the role of a support worker. And D. The amount of time it takes to perform a skill. The answer is C. The limit and extent of a healthcare worker's role as determined by your province, educational standards, and your employer's policies in order to protect clients from harm. Scope of practice in healthcare field varies from province to province and employer to employer. Question number 4, multiple choice, choose the best answer. Support workers can advocate for their clients by A. Never leaving their client's side. B. Providing empathetic care. C. Speaking or acting on behalf of the client when necessary. And D. Acting appropriately at all times. The correct answer is C. Support workers can advocate for their clients by speaking or acting on behalf of another person or group of people. Question number 5, multiple choice, choose the best answer. The ultimate goal of support work is to A. Alleviate clients' pain. B. Improve clients' quality of life by providing compassionate care. C. Keeping the client clean and dry at all times. And D. Perform all assigned duties. The correct answer is B. The ultimate goal of support work is to improve the quality of life of the client and family by offering client-centered care and support in a safe, kind, sensitive, caring, and understanding manner. Question number 6, multiple choice, choose the best answer. An example of discretion would be A. Using responsible judgment when speaking about the client. B. Refraining from using client's name when talking about them in the lunchroom. C. Speaking to the client's family and friends about the care the client receives. And D. Talking to your coworker about your private life while you are making beds. The correct answer is A. The use of responsible judgment to avoid causing distress or embarrassment to a person. Number 7, multiple choice, multiple response question. Choose all of the correct answers. Instrumental activities of daily living include A. Grocery shopping. B. Basic home maintenance. C. Book medical appointment. D. Toileting. E. Cleaning the toilet. The correct answers A, B, C, and E. Instrumental activities of daily living are complex and necessary skills needed to successfully live independently, also known as IADLs. Number 8, True or false, you may discuss your romantic life to a client as a form of entertainment while working for him. The correct answer is false. A professional demonstrates discretion about personal matters. Discretion in support work includes keeping personal matters out of the workplace. Number 9, choose the best answer. Critical thinking means A, keeping one's feelings to oneself, B, approaching your work with enthusiasm, C, being critical when thinking or speaking of another person, and D, the ability to think clearly and logically using reflection and reason. The correct answer is D. Critical thinking is the ability to think clearly and logically using reflection and reason based on knowledge and obtained from experience, observation, and education. Question number 10. Choose the best answer. A support worker is considered to be a regulated care provider, B, an unregulated nurse, C, an unregulated care provider, and D, a certified support worker. The correct answer is C. The support worker in most provinces and territories are considered to be UCPs. Unregulated care provider are healthcare providers who perform clearly identified services under the direction and supervision of a client, family member, regulated healthcare providers, or employer. Question number 11, multiple choice. Choose all of the correct answers. Where should you find information about your scope of practice? A, supervisor. B, patient. C, the educational program. D, the employer's policies. E, co-workers. The correct answers, A, C, and D. Three important sources that determine the support worker scope of practice in any province, territory, city, or municipality are the following: Provincial Territorial Educational Standard of Practice, Employer's Policies, and Supervisor. Number 11, 12, multiple choice. Choose the correct answer. The acronym DIPPS stands for A, disability, independence, physical, and safety. B, dignity, independence, privacy, preference, and safety. C, defend, interdependence, privacy, preference, and safety. D, decency, independence, privacy, preference, and safety. The correct answer is B. DIPPS, an acronym for the 6 principles of client-centered care, also known as compassionate care or person-centered care: dignity, independence, or individualized care, preferences, privacy, and safety. End of chapter 1.